Dopaminergic pathways. Dopamine is an important neurotransmitter involved in multiple functions including movement, emotional regulation, reward, and cognition. In humans, the four major dopaminergic pathways are the mesolimbic pathway, the mesocortical pathway, the nigrostriatal pathway, and the tuberoinfundibular pathway. The mesolimbic pathway, sometimes referred to as the reward pathway. The pathway connects the ventral tegmental area in the midbrain to the ventral striatum of the basal ganglia in the forebrain. The ventral striatum includes the nucleus accumbens and the olfactory tubercle. The release of dopamine from the mesolimbic pathway into the nucleus accumbens regulates incentive salience, for example, motivation and desire for rewarding stimuli, and facilitates reinforcement and reward-related motor function learning. The dysregulation of the mesolimbic pathway and its output neurons in the nucleus accumbens plays a significant role in the development and maintenance of an addiction. The mesocortical pathway is a dopaminergic pathway that connects the ventral tegmentum to the prefrontal cortex. It is essential to the normal cognitive function and is thought to be involved in cognitive control, motivation, and emotional response. The nigrostriatal pathway is a bilateral dopaminergic pathway in the brain that connects the substantia nigra pars compacta in the midbrain with the dorsal striatum, that is, the caudate nucleus and putamen in the forebrain. Nigrostriatal pathway is critical in the production of movement. Degeneration of dopaminergic neurons in the substantia nigra is one of the main pathological features of Parkinson's disease, leading to a marked reduction in dopamine function. And the symptomatic motor deficits of Parkinson's disease, including hypokinesia, tremors, rigidity, and postural imbalance. The tuberoinfundibular pathway transmits dopamine from the hypothalamus to the pituitary gland. Dopamine released at this site inhibits the secretion of prolactin from interior pituitary gland lactotrophs by binding to dopamine receptor D2. Some antipsychotic drugs block dopamine in the tuberoinfundibular pathway, which can cause an increase in the amount of prolactin in the blood. A patient has developed amenorrhea and galactorrhea as an adverse effect of dopamine 2 receptor blockade from treatment with antipsychotics. There are four major dopaminergic pathways in the brain, for example, mesolimbic, mesocortical, nigrostriatal, tuberoinfundibular. Dopamine hyperactivity in the mesolimbic pathway is associated with positive psychotic symptoms, for example, hallucinations, delusions. The therapeutic effect of antipsychotics arises from blockade of D2 receptors in the mesolimbic pathway. The side effects of antipsychotic therapy are largely caused by dopamine 2 receptor blockade and other dopaminergic pathways. The tuberoinfundibular pathway connects the hypothalamus to the pituitary gland and is responsible for the tonic inhibition of prolactin secretion. Neurons in the arcuate nucleus of the hypothalamus secrete dopamine, which binds to D2 receptors on pituitary lactotrophs, resulting in decreased prolactin secretion from the interior pituitary gland. Antipsychotics can interrupt the tuberoinfundibular pathway, causing increased blood prolactin levels, hyperprolactinemia, which may lead to galactorrhea, milky nipple discharge unrelated to pregnancy, breastfeeding, and menstrual irregularities, for example, amenorrhea. The nigrostriatal pathway projects from the substantia nigra to the caudate nucleus and putamen and primarily regulates the coordination of voluntary movements. Dopamine 2 receptor blockade in this pathway results in extrapyramidal effects, for example, dystonia, akathisia, tardive dyskinesia, and drug-induced Parkinsonism. The arcuate fasciculus is a neural pathway that connects the Broca and Wernicke areas, which are responsible for expressive and receptive language, respectively. Disruption of the arcuate fasciculus classically results in conduction aphasia, characterized by fluent speech, intact comprehension, and impaired repetition. The hypothalamo-spinal tract projects from the hypothalamus to the ciliospinal center of the intermediolateral cell column T1 to L2, providing sympathetic innervation to the ipsilateral eye and face. Disruption of this tract typically results in ipsilateral Horner syndrome, for example, ptosis, meiosis, and hydrosis. The lateral medullary spinothalamic tract transmits pain and temperature signals from the contralateral body to the thalamus. Lateral medullary infarction Wallenberg syndrome presents with loss of pain and temperature sensation on the contralateral body and ipsilateral face, as well as vertigo, hoarseness, dysphagia, and abnormal eye movements. Antipsychotic medications work by blocking dopamine 2 receptors in the mesolimbic dopamine pathway. Dopamine 2 receptor blockade in the tuberoinfundibular pathway can result in galactorrhea and amenorrhea.